Hey guys, okay, so I wanted to talk a little bit more about what I mentioned in my previous video. I mentioned the word floxed. I'm going to get to that here in just a second. I wanted to bring up fibromyalgia just a little bit more. For those who do not know, the trigger point test, let's see if I can get the light. These are where they push on you. So if you want to, I'll leave it up there for a second. You can pause the video, use your snip app on your PC, or screenshot it if you're on your phone, and you can do it yourself, or you can have somebody do it to you. Even if you don't have symptoms, I want you to do this. Because I guarantee you a lot of these places are sensitive, even if you don't have symptoms of this. These are sensitive areas, especially if you have a lot of fatty tissue around these areas. And I actually found an article, of course, I exited out of it. I've found a couple articles trying to debunk the whole fibromyalgia trigger point thing. That if you have a lot of fatty tissue in these areas, or if you're very bony in these areas, it's going to be tender. Now let me show you this again. Okay. Now, my inner thighs, I have a lot of cellulite. My outer thighs and hips, and right above my buttocks, which is considered your hips, I have a lot of cellulite and fatty tissue. Hang on just a second. Let me get the light to adjust again. And then my arms are usually sensitive. They push usually right above your elbow, on your bicep. But when I push on it, it's almost like right here. But I have to push like really hard. And it's like, yeah, it's a little tender, but I mean, it's like, okay. And then you see the ones right above on the chest. Let me push it a little closer. Okay. I am very bony. Okay. Just going like this hurts my sternum. My sternum sticks out. My clavicle sticks out. I'm like just touching it sometimes. I'm like, it not necessarily hurts, but it's like, it's sensitive. Like, it's just, I'm very, very bony. I mean, if you look at my bones, I am a very bony person. Like, that's why when I lose weight, I look like I've lost too much weight, because I'm just a very bony person. So when I'm my normal weight, I look like a crackhead. Even though because when I was weighing 130, which is a healthy weight for me actually, people were telling me that I looked like Skeletor. And I'm like, I could still lose 10 more pounds and be within my healthy BMI. But I would look like a crack addict just because of how bony I am. That's my point, is it's a sensitive area to some people. And then you see on the back of the neck, and the shoulders, and on the back, all of those areas, whenever they would push on those areas, I would actually be like, like, because they push on them and they'd be like, does that hurt? I'm like, no, that feels good, actually. And they're like, is that tender? And I'm like, it hurts, but it feels good. In the sense that my muscle hurts and it feels like you're giving me a massage. Not in the sense of it's tender, ow. In the sense of, yes, please keep pushing. That feels good. Not where, like, when they would push on my hip or something, it's like, ow, stop, stop, stop. So technically, and, there are 18 of them. In order to be diagnosed, almost everything that I've found, I thought it was 9. I was wrong, and that's why I didn't state it in my last video, is because I wasn't completely sure. Because I thought it was 9, but I thought I remember seeing a different number. It is 11. You have to have 11 of these 18 trigger points. Okay? I have 4 that are actually like, ow, 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 ow. I have 2 that are like, yeah, it's tender. And then I have 2 that if you push hard enough, yeah, it's a little tender. Okay, so let's do the math on that. 4 plus 2 questionable plus 2 even more questionable. That's still only 8. So how do I have fibromyalgia? It's a good question. Let's see. So according to that, according to the point the point test thing they do, I do not have fibromyalgia. Okay, so moving on. So I was diagnosed incorrectly because there was no other basis for them to diagnose me on, and they didn't even do the damn test. So, and other doctors who have done the test, those are the. So there is no possible way to lead to the diagnosis of fibromyalgia for myself. So, and I suggest other people educate yourself as well. And if you do legitimately have what they call fibromyalgia, you need to find a doctor and literally call the doctor's office and ask them, A, are they seeing new patients? And B, do they have doctors on staff who believe fibromyalgia is a symptom of a disease? And if they say no, then call another doctor. You will eventually find one. You may have to kind of go a couple of hours drive away from you, but hopefully you will find one. I was actually talking to somebody overseas in a chat room that I met online. She's on a fan page and with me. That I met through a fan page, and we were sharing stories, and I told her what to do, to call doctors and literally ask that, and she was afraid to at first, and she did, and she actually found one that did believe that fibromyalgia is a symptom of a disease and not a disease itself, and she told me, she was like, I actually found one. She's like, it's about an hour drive away from me, and I have an appointment with them, and I'm like, that's awesome. So anyways, I'm trying to remember where I saved. Okay. Sorry. I got a little sidetracked. So, what is fibromyalgia? Now, this is from WebMD.com. And this is the same, pretty much same thing that I got from Mayo Clinic and health something.com as well. Fibromyalgia is a syndrome with multiple symptoms that commonly occur together, including widespread pain, decreased pain threshold or tender points, incapacitating fatigue, and anxiety or depression. Okay. I have the pain and the fatigue. The depression came after I passed out at work and I couldn't go back to work because no doctors would listen to me. I was dealing with the pain. Fine. I was going to pain management and dealing with it. So, but that sounds like a lot of other things. And they even have a thing that says, why is diagnosing fibromyalgia difficult? Well, it's a bunch of bullshit, so I'm not even going to go through it. You can research it on your own if you'd like. Anyways, whole point of this was the floss. Okay, Andrew, he gets on whenever I'm in a lot of pain or something's going on with me. He gets obsessive and he starts looking into things. Fluoroquinolones. They are antibiotics. You would know a lot of them by the names of Avelox, Levaquin, and Cipro. Now, my antibiotic of choice is Cipro because it kills everything. And a lot of times I've been given Cipro and Levaquin because as a child I had chronic bronchitis, pneumonia, asthma, and that's Cipro and Levaquin are usually the first two things that they would go for respiratory illnesses like that. Anyways, I didn't know this, but there's been for a while people protesting these things saying they're poison, and I didn't know that. Even whenever I have a toothache, usually they give me penicillin first, and if that doesn't help, guess what? They give me Cipro. Especially since I'm allergic to sulfas now. Which I don't think I am, but because Floyd thinks I am, I have to stay away from him. So here's what they are. Hopefully, I don't ever come in contact with anthrax because Cipro's what they give you. Fluoroquinolones, Cipro, Levaquin, and Avelox, are among the most commonly prescribed class of antibiotics in the United States, but they carry severe side effects that can harm your central nervous system, musculoskeletal, visual, and renal systems, sometimes simultaneously. Because of their side effects, they're supposed to be used only to treat serious bacterial infections that won't respond to any other treatment. Instead, they're often offered for mild conditions like sinus, urinary tract, and ear infections. Tendon rupture, retinal detachment, hallucinations, personality changes, kidney failure, brain fog, psychosis, loss of memory, have all been reported by use of fluoroquinolones. Okay, so we've been looking into this, and there have been some people, like one person will have like 3 of the symptoms I have, and then the other person will have like 6 of the symptoms I have, and then another person will have like 10 of the symptoms I have, and then another person will have like 4 of the symptoms I have. And I've been through this before. So I'm not putting any hope into this whatsoever. Because I went through this with the mycotoxins. Whenever I found out about mycotoxins, I read this narrative that this woman wrote about mycotoxins. And to quickly inform you, if you don't know what mycotoxins are, mold. Just to simplify it, mold. Growing in your body, pretty much. I read her narrative, and it literally sounded like I wrote it. So I was determined. I was convinced that's what I had. It wasn't. I couldn't afford the test. But the doctor that I was seeing, that I trusted very much, assured me that he didn't think that's what it was. This time that I went to the Mayo Clinic, the only good that they actually did do me was when they did the head CT. It would have shown mycotoxins if I had them. So they saved me $600 out of pocket of doing the test. Even though it cost me $1,500 out of pocket to fucking go down there. But anyways. Being floxed pretty much is this. You take one of these antibiotics, and it becomes toxic in you. It can lay dormant, or it can happen right then and there. And you can have a reaction to it right then and there. Or it can kind of lay dormant in you. And you can take something else that reacts with it. The top things that react with it are the number 1 things that I go to whenever I have an episode or something wrong with me and I end up in the hospital, because they keep thinking I have an autoimmune disease, which is steroids and NSAIDs. As soon as I have a pain or something, the first thing I reach for is my ibuprofen. Before I started pain management, I was eating ibuprofen like candy. And even while in pain management, before I take a pain medication, I try ibuprofen first to see if that helps first. And especially for my teeth. Because I don't want to waste pain medications for my body on my teeth if ibuprofen's going to help it. And anytime my shoulders would swell up or anything, they would inject me with steroids. There was one year where the nurse looked at me and told me, she said, do not get any more steroids for at least a year. She said, if you get sick, if you get a respiratory illness and you get put in the hospital, you have to tell them not to put you on steroids no matter what. Because it could kill you. Because that's how much steroids I had that year. Both orally and IV and subcutaneously. Injection wise and everything. I'd had so many steroids that year. They told me you cannot have any more for a very long time. It will hurt you. So me thinking back, trying to say, okay, if this is a plausible thing, I'm thinking, okay, I took a lot of antibiotics as a child. My mom always brings that up anytime she goes to the doctor with me. And especially back then, um, especially with children, in practically respiratory distress, I mean, because I had pneumonia most of the time I went to the hospital. I mean, the first thing they give you is Cipro. I mean, she'd take me to the doctor, and the doctor would give me Levaquin or Cipro. Sometimes I think he'd give me Vanc, but usually for whenever I'd have bronchitis or pneumonia, they'd send me to the hospital. But whenever I'd have bronchitis or anything like that, it was Cipro or Levaquin. I even was chatting with my mom about it the other day, and she even confirmed that I was on Levaquin and Cipro a lot as a kid, and that could be the reason for my tooth decay. And I was also on the mycins, the I can't remember what they're called. I took pharmacology a long time ago. It's been a while. The vancomycin and all those other ones. I mean, I've been on a lot of antibiotics, even the penicillins. Amoxicillin and penicillin and all that. But she remembers Levaquin and Cipro a lot, especially Levaquin. And I remember being a teenager, having Levaquin a lot. I mean, I still remember what the pill looks like because I had to take it so much. Trying to timeline it. My thyroid messed up first. That was the first thing to mess up. And that was when I was around 20, maybe 21, 20, 21, somewhere around there. 20ish. And I mean, I'd had both Levaquin and Cipro and the mix of steroids, and because I mean, when you have a respiratory illness, they give you a steroid and an antibiotic, so there you go. But I didn't get sick. The main thing I remember when I was working at Amazon, early 2013, right before the December 2013 episode where I got really, really sick and this all started. I remember when my shoulder first started acting up. Right before that is when I had all my teeth taken out. They put me on Cipro. And because of somebody that I'm not going to name, because that person has repented and asked for forgiveness, I ran out of pain medication very quickly. I didn't want to ask the doctor for more pain medication, so I quickly switched to ibuprofen while I was still on the Cipro. And thinking back, right after that is when I went back to work. And when I went back to work, I noticed my shoulder was hurting, but it wasn't hurting when I was at work. It was hurting when I'd wake up and it'd be swollen. And I'm like, well, maybe it's just because I'm not used to working, because I was off for, a couple days while my teeth were healing, or my gums were healing, whatever. So, I ended up, and I'm thinking, I worked all through peak, which is a very, very busy time, and didn't sustain any injury. So me being off for a few days and then coming back shouldn't have hurt me. Well, then we ended up having a slow time. We had what's called VTO, which is voluntary time off, and which means you can take off and not get pointed for it, which means, you don't get written up for it. And so since I kept I kept waking up with my shoulder hurting, I took the VTO, and I ended up with almost 3 days off. And those 3 days, my shoulder got worse. And I ended up having to see a bunch of doctors for it. And I told them, I'm like, I just woke up like this. I don't know what happened. And that's when the steroids started. That's when they started injecting me with a bunch of steroids. And then it was my back. And then they started injecting me in my back with steroids. And then I started seeing a physical therapist. And I was off of work forever. And that's whenever everything started spiraling out of control, all that beginning of 2013. And then I went back to work, and they were supposed to switch me to picking because it was going to be easier on my back and everything, and it didn't, so I had to resign. I think that's when I went back to VOA, and then that Christmas is when I got sick. Right before Christmas, the 23rd, is when I got sick. And I actually think I had another round of antibiotics in between there for my teeth. I'm not sure. But when I was thinking back, whenever he was talking to me about it, the main thing that stuck out was it was right after I had my teeth pulled out and I was put on the antibiotics is when my shoulder started acting up. And all of this started. So, again, I am not going to put my eggs in the basket. I am not going to use the word hope anymore. At all. Done. I'm so fucking done with that word. Unfortunately, the only test there is a blood test to see if there's too much fluoride in my system. The only way to really know if I am fluxed is to start the treatment. And if I feel better after the treatment, then I'll know that's what it is. And the treatment is pretty much IV treatments of this type of mineral supplement. I don't know what it is exactly. He was explaining it to me earlier. And then there's also diet and supplements you take and stuff like that. So she's gonna go crazy because Andrew's here. So I'll continue this later on.